So welcome to the Detroit Air Pollution Panel. I'm Saurav, I'm one of the co-presidents of Science Policy Network Detroit. We can get right started into the panel. At the beginning, we're going to go through some of the updates and what we're going to go over the agenda of the meeting. So for anybody here that is new, we just wanted to introduce what Science Policy Network Detroit is. So we were formed to advocate for science-based policies, and we are trying to bridge the gap in communication between scientists, policymakers, and the public. And this is open to anybody, so anybody can join, doesn't matter what your discipline is. So a few updates. The final two events of our communication advocacy series that we've been doing this past semester will be on the 15th and the 29th. These are reserved for those who attended 2 or more of the best trainings that we had the past few weeks. Just as we stated at the beginning of the communication advocacy series, if you wanted to meet with lawmakers, you had to attend these meetings. So those who did attend will receive an email from us. But if you still want the chance to meet with lawmakers and you did not attend all these meetings, we suggest that you join these action groups. And we need more general members to be joining, so please sign up for that. There's also a position available for those who want to become higher in Science Policy Network Detroit, have a bigger impact. You can be our NSPN Liaison. So you would be representing Science Policy Network Detroit at the National Science Policy Network meetings. So here you'll be able to present on different topics, and you'll also hear from other Science Policy Network groups across the country. You must be available at 8 p.m. at the first Tuesday of every month, though, and you will have to become a formal member of the National Science Policy Network.
So if you are interested, please email us at scipol-detroit@wayne.edu as soon as possible.
So the format of the panel will be, we're going to introduce the panelists at the beginning. Then we have some pre-prepared questions for the panelists. And then after that, we will have an audience Q&A. So during the moderated discussion, submit your questions in the chat and we will call on you during the audience Q&A. So without further ado, we'll have our panelists introduce each other or introduce themselves from left to right, beginning with Professor Schreck.
Thanks very much. Thanks for the invitation to be here today. And it's great to be here with a couple friends, Amy Schultz and Wilkins, and excited to discuss with Dr. Huang as well. And so a little bit about me. So I am Associate Dean of Experiential Education at Detroit Mercy Law School, so just down the road from Wayne State. And there, more pertinent to today's discussion, I direct our environmental law clinic. So the students that I work with, we engage in all types of different legal matters related to the environment, but specifically for today's discussion, we do a lot of work on permitting related to air pollution, as well as other types of pollution. But certainly something I'll talk about today is how air permitting kind of works and what we might be able to do from a policy and advocacy perspective to try and improve the air quality in Southeast Detroit. And I should also mention that I am, formerly I taught at Wayne State at the law school there, and I still work with the CURE Center, which is the Center for Urban Responses to Environmental Stressors, where I work on community engagement there. And Danelle and I both are part of the CURE Center, and then I also work directly with Amy on some work with CAFE that I think she'll probably mention at Michigan. And so, again, I'm very happy to be with you all here today, and I look forward to the discussion. Thanks.
Thanks, Nick. And I'm Amy Schultz. I'm based at the School of Public Health at the University of Michigan. Really delighted and grateful to the organizers of this session for pulling together this opportunity to talk about air quality and public health, which is the way that I come at this particular topic. And so honored to be able to share, to be part of a panel with my colleagues today. So I'll turn it over to Donnell.
Well, good afternoon, everyone, and thank you for having me be a part of this important, crucial discussion around air quality in the city of Detroit. I'm Donnell Wilkins. I am the founder and director of the Green Door Initiative, which is a Detroit-based not-for-profit environmental justice organization. I've been doing environmental justice work for, I just learned, 3 decades. I can no longer say 2 decades, and have been on the front line addressing environmental justice issues in the city of Detroit, the state, as well as on a national level. And I look forward to a robust conversation with my colleagues.
I think it's going to be my turn, right? Hi, everyone. My name is Huang. Thank you very much for the invitations. I'm really glad to be here on a panel to discuss the air pollution and air qualities. I am an atmospheric chemist and assistant professor in the Department of Civil and Environmental Engineering here at State. And my group studies like air pollution, air quality, climate change, and how it impacts the human health. We primarily use regional and global chemical transport models to quantify the impacts of air pollution on our air qualities and also human health. Primarily focus on the particulate matter and ozone because they are health relevant and also climate relevant. So look forward to discussing this kind of interesting topics with other panelists and also the audience. Thank you.
Thank you so much for those wonderful introductions. And as Carrie Leach said in the chat, this is an amazing panel full of such expertise. So we're really excited to dive into it. And I just want to make a note that Dr. Huang is going to be our faculty leader for the Air Pollution Action Group for our summer initiative. And we're really excited to have you and to learn from your knowledge. So if you guys are interested in that action group, we've been sending a lot of links in our emails for you to sign up. So if you are interested, please do so. And so with that, we will get into the moderated Q&A. And just a note, we will be asking each panelist a question directed to them. And then if any other panelist has anything to add to that question, feel free to do so after your fellow panelist is done answering it. So let's get into it. Sora will be starting the first question. Oh, just kidding. Brianna will.
I was like, wait, that's my cue. Hi, everybody. Welcome. So this first question is aimed for Dr. Schultz. What are some of the present and prominent issues and events surrounding air pollution?
Okay, great. Thank you, Brianna, for that first question. Many of you may know that air pollution is a concern because it is a known contributor to adverse health outcomes in the United States as well as globally. Depending on the type of pollutant, their established health effects include impacts on the cardiovascular system, increased risk of heart attacks and other cardiovascular events, poor birth outcomes for women who are exposed during their pregnancy, cancer, asthma, and other adverse respiratory effects. So it's been a concern for a long time in the United States as well as globally. In the US, we passed the Federal Clean Air Act in 1970, something that Nick might talk a little bit more about. And since that time, overall, air quality in the United States has improved substantially. We've seen great improvements in the quality of our air. This is also true in Detroit. However, one of the things that's really important to understand is that those improvements in air quality have been uneven. and that there is substantial evidence that low-income communities and communities of color remain disproportionately adversely affected, so to have higher levels of air pollution and their adverse health effects. And this is true nationally. It is a factor in Detroit and the surrounding areas. And in particular, in Metro Detroit, one of the areas of concern is that communities with greater proportions of non-Hispanic white residents enjoy better air quality as a general rule, compared with communities that have greater proportions of non-Hispanic, Black, and Latino residents, which raises concerns about associated health inequities that are linked to those differential impacts. Even as air pollution has continued to decline in general over time, we've continued to build the evidence base. And so researchers like Dr. Huang and others have continued to build the evidence of the adverse health effects. And one of the things that we've come to understand over time is that there are adverse health effects of air pollutants at lower and lower levels as we have built that evidence base. And therefore our standards related to levels of air pollutant, those are set in terms of their safety or adverse health effects. And so those standards have also continued to come down and be set at lower and lower allowable levels of air pollution over time. We do know that a recent report by the World Health Organization has estimated that air pollution kills an estimated 7 million people worldwide every year. So that's a pretty big number. In the Detroit metro area, we've done some work on this, and our estimates suggest that air pollution is responsible for almost 700 deaths a year just in our Tri-County area, Wayne, Oakland, and Macomb County. It's also responsible for about 1,800 hospitalizations due to asthma exacerbations and other health impacts annually, with an estimated cost of about $6.9 billion annually. And that's just linked to the levels of air pollution that we encounter in this part of the state. Currently, Southeast Michigan is out of compliance with federal standards for both ozone and sulfur dioxide, and those are both linked to substantial health impacts, which Dr. Huang may talk a little bit more about. And so those are levels that are of concern, and that sets in motion a series of actions that need to be taken to try to get us into compliance with those federal standards. You asked about present and prominent issues and events related to air pollution. And in the Detroit metro area, those have to do with both what are called point sources of air pollution. So these are industrial sources of air pollution, things like the Detroit coal-fired power plants that are located in our region that contribute substantially to sulfur dioxide levels. Those are issues of concern. Because of their contributions both to air pollution and to climate-related change. We also have concerns in the Detroit metro area related to what are called mobile sources of air pollution, and those are things like diesel trucks and shipping trains that emit large levels of diesel air pollutants, which are specifically linked to some cancers and other adverse health effects. And in areas of Detroit, of the metro Detroit, where we have high levels of, for example, freeways, I-75, freeways converging to go over the bridge to Canada, the communities that are immediately adjacent to those high trucking areas have particular health-related concerns linked to that type of air pollution. So.
Our next question is for Dr. Schreck. What are the key sources of air pollution in the city of Detroit? Just as Dr. Schultz had talked about, what are the most prominent ones?
Yeah, that's a great intro. Thanks, Amy. And I think, you know, thinking about the Clean Air Act and the way that we regulate sources of air pollution is a good frame, I think, for this discussion, because as Amy mentioned, we have our stationary sources, or these point sources of air pollution. So think of smokestacks, right? You see the factory, you see the billowing smoke coming out of that big smokestack up into the sky. That's a stationary source, and we have many what are called major stationary sources within the city of Detroit, but also in our neighboring communities, which are upwind of Detroit, meaning that the wind prominently when it's blowing from west to east pushes that pollution through our communities as well. And we have a lot of these major stationary sources of air pollution within Southeast Michigan. And so, yes, coal-fired electric power plants, we still have those. And there's, you know, a very large coal-fired power plant in Monroe, Michigan, which does impact some of our air quality in Metro Detroit. But then we also have a coal plant in River Rouge. We have a coal plant in Trenton that these emit, you know, large amounts of sulfur dioxide, as Amy mentioned, as well as CO2 and other pollutants. And critically, both the River Rouge and the Trenton coal plants, they're older. They are out of date, they're inefficient, and they pollute a lot more per kilowatt hour of electricity generated than certainly a modern coal plant would, and certainly more than other sources of electricity, which we'll talk about in just a second. So we have those. We have steel mills, right? So there's a U.S. Steel facility right on the Southwest Detroit Dearborn border. There's a AK Steel facility right next to U.S. Steel. So these large steel mills, which are again major sources of air pollution. We have a lime factory, Carmeuse Lime, very large major source of air pollution. Coke batteries, so not Coca-Cola, but Coke that is actually used in the steel producing process, heavily carbon intensive and major sources of air pollution. So we've got a lot of those. And as Amy mentioned, while these facilities may be in compliance with their individual permit, their Clean Air Act permit that regulates their pollution, that doesn't mean that neighborhoods right near these facilities aren't receiving much more pollution than those of us in the Tri-County region, or certainly in the state as an average. And so there are these hotspots that you see next to these major sources. So again, even if they're operating in compliance with their permit, and sometimes they don't, but even when they are operating in compliance with their permits, that doesn't mean that there aren't impacts and health impacts to the surrounding neighborhoods. And then additionally, we have our mobile sources. And so yes, trucks, cars, planes, lawnmowers. You know, when we hear about the ozone action days that we're not supposed to fill up our cars with gasoline, and we should avoid using small internal combustion engines like lawnmowers, that's because of the contributions they make to ozone and other sources of air pollution. And we do have a problem with auto transportation emissions in Southeast Michigan. There are choke points within our highways and roads. And so even as our population has been pretty stagnant in the region, we continue to struggle with high levels of emissions from vehicles. A lot of that has to do with the age of trucks and the fact that they have older engines and they're more polluting diesel engines, as Amy mentioned, than perhaps some newer technologies that are less polluting. So that's a huge problem. People that live next to highways, Amy touched on this as well, we see negative health outcomes. The closer in proximity you live to a highway, the more likely you are to have health-related impacts from that pollution. And of course, in Detroit, we have highways that have been, blasted right through the middle of the city. And so people that live in neighborhoods adjacent to those roads are exposed to more pollution than folks in more rural areas. So those are kind of the major sources. We have a lot. And the final thing I'll leave you with is it's not just us here in a little bubble. We get air pollution coming in from other states. We get, pollutants coming in across Lake Michigan that come into the state from Illinois and Indiana. And then of course we contribute air pollution to our friends in Ontario and then other states in the Northeast. So it's not like things are necessarily stagnant and they stay right here in our little bubble. It gets up in the air, it moves around, and so that's a challenge we have too, things coming in from other places.
Great, thank you for that wonderful introduction, Amy, and for expanding on where air pollution comes from, because I think it's a great setup for people who aren't familiar with the issue to know. So next question for Dr. Huang. How are air pollutants generated by these sources that Dr. Schreck expanded upon, and how are they measured? So are there specific tools or data collection methods that you could talk about?
That's a very good question. And I teach air pollution engineering at Wednesday, and I keep talking that for a whole day, but I will make it short. So common air pollutants generated from the what Nick has said about is that it include like particulate matter, nitrogen oxide, sulfur dioxide, carbon monoxide, volatile organic compounds, and also heavy metals, right? And these are the criteria air pollutants. And these air pollutants are generated from combustion and non-combustion processes. However, they generally like co-emit within one systems from, for example, from our traffic, industrial and power plants, petroleum industrials, and so forth, so on and so forth. So, but I will give you an example of our mobile systems, our tailpipe emissions from our transportation systems. We use gasoline and diesel to power our vehicles right every day. And trucks normally use diesel. On the highway, we can see that. Diesel fuels contain higher number of carbons in the fuels. So during the combustion processes, it needs high pressures in the engine. So inside the engine, the oxygen from our air supplies sometimes do not react with the fuel itself, but instead it just reacts with the oxygen and the nitrogen in the air. So that leads to the nitrogen oxides productions under the high temperatures and pressures. And so that leads to the nitrogen oxides emissions, really high amounts. And simultaneously, the combustions of the higher number of carbons from the diesel fuels leads to the emissions of this kind of soot particles. We call it black carbon or soot. So that's why you always see this kind of black smoke coming out of this kind of diesel trucks, tailpipes, right? And by contrast, for our gasoline vehicles, for example, the passenger cars that we use in the United States, it is quite different from Europe. Europe use a lot of diesel for the passenger cars. The gasoline fuels used by our passenger cars in the United States tends to emit more volatile organic compounds and carbon monoxide compared with the diesel vehicles. So that leads to really different impacts for the particulate matter and ozone. I just have a paper coming out last year to quantify the impacts of global gasoline and diesel vehicle emissions on our air quality and human health. So you can see that's quite different impacts on the ozone in terms of spatial and temporal variabilities, and can also impact on the human health in terms of the premature death. So that is just the example about the generation mechanisms for the air pollutants from our anthropogen emissions. And in terms of the air pollutant measurements, our United States, like EPA, has funded local air quality management agencies. In Michigan, we call that Michigan Eagles, Department of Environment, Great Lakes, and Energy, to continuously monitor various like air pollutants. And that includes those criteria air pollutants, right? For example, for the measurement of PM, NOx, sulfur dioxide, carbon monoxide, ozone, and lead. And over the Metro Detroit, we have over about like 10 sites for the continuous measurements of particulate matter, PM 2.5. And most of that locates over our Wayne counties. And for the measurement of PM 2.5, it's normally use the EPA federal equivalence method to measure. For example, the EPA use the continuous like particulate monitor for PM 2.5 mass concentration detections. We generally use the MET1 instruments model like the BAM 1020 to measure PM 2.5 mass concentrations. And in principle, this instrument apply the principle that the carbon-14s can emit a constant source of high energy electrons. And we also use other, of course, other like the filter-based, like the PM 2.5 instrument to cross-validate the PM 2.5 concentration measurements. So at every site, generally we have 2 to 3 PM 2.5 instrument to measure that. And interestingly, we over the United States or even globally, we start to use low-cost PM 2.5 sensors to measure that. For example, the purple air sensor is really right now, it's very popular. Over Metro Detroit or Metro like over even Michigan, we start to use the purple air by ecology center of nonprofit organizations. And even my group, we also start to use the PM the proper air sensor to measure PM 2.5. And also our own state, we have like the Detroit Air Nets organized by the student organizations to plan to deploy more proper air sensors to measure PM 2.5 concentrations over Metro Detroit, which can substantially expands the networks of the morning network in terms of PM 2.5. However, it is still very sparse. If you take a look at the census distributions, some of the regions we still are still really limited. We definitely need to increase more sensors over these regions to improve our understandings of how the impacts of the air pollutions on our air qualities, and we can better quantify the health effects. Thank you.
Alrighty, and the next question is aimed for Ms. Wilkins. How are Detroit residents affected by air pollution? Does this increase the effects of pre-existing conditions or illnesses like asthma or even COVID-19?
So thank you for that question. So let's start with the most obvious. Yes, air pollution does affect pre-existing conditions like asthma. In fact, air pollution can be a major trigger for asthma and increased hospitalizations and emergency room visits, as well as school absenteeism, because children who are dealing with asthma and the inability to breathe are more likely to miss school at 3 times more than their counterparts in other places like in Detroit. So definitely that is an issue. We also know that because of the presence of poor air quality, the impact, the toll of COVID-19 has had on communities like Detroit are just out of just palpable and very, very harsh in terms of people being able to breathe just on a regular basis, and then having the complications of a pandemic that attacks their respiratory systems and lungs. That's a pretty huge battle for people who are consistently exposed to poor air quality. So let me step back a little bit and say that it's more than just being able to breathe. There are evidence that links air quality to birth outcomes, for instance. The fact that in some places in Detroit, the birth outcomes are worse than some third world countries because of the proximity to freeways and mobile sources of air pollution. Those trucks that Nick and Amy spoke about in their emissions can really influence that. And also untimely premature deaths of moms trying to deliver their children have been exacerbated by exposure to poor air quality. There are issues that are also linked to just neglected areas in the city where there are facilities that, for instance, lead smeltering facilities that actually burn and crush automobile batteries throughout the city of Detroit, mostly concentrated on the east side of Detroit, as a matter of fact, and the impact that heavy metals that Dr. Huang just mentioned can also influence a person's ability to live a thriving life as exposed. Now, we know where that comes from, the historical legacy of discriminatory housing practices that relegated people to live in areas that, not because of affordability, mainly because of the color of their skin. And then, of course, affordability factors and whatever are considered in this. But there's no accident that more than 2/3 of the known polluting facilities for the state of Michigan are located inside the city of Detroit and the county of Wayne, where, by the way, most of the people of color for the state of Michigan also reside. And so when you see those health outcomes, it should not come to be a surprise that the concentration are in places where people of color and very low income people live. And let me see, what else did I want to mention about this asthma? So there is also this issue of unequal protection under the law when it comes to environmental protection. And so when the lack of enforcement, lack of oversight in communities that are disproportionately impacted by these exposures occur, then you're going to see even more cases of people not being able to live a healthy lifestyle. And then you factor also access to healthcare options, and then that process is even more devastating. We in Detroit, known as the Motor City, has placed the world on wheels. The visionary Henry Ford had this idea that all things automobiles should be in close proximity. And if you take a little drive or walk around the city of Detroit, you can see the evidence of those patterns. And it's no surprise that because of the historical housing discriminatory practices, or I will say, Dr. Bob Bullitt put it this way, residential apartheid, you will also see where people live and where industry is a natural and there's a natural sort of coexistence that occur as a result of that. So unfair policies, public policies that sort of encourage this, discriminatory practices and systemic racism contributes to this. And I emphasize this because a lot of times there's this emphasis on blaming the victim or health behavior. Oh, these people must be smoking. Or these people, are not exercising. There's something else going on that makes them vulnerable. Well, let's just look at how policies are done in this country, in this community, and as an example of that. So, of course, there are other issues like cancer and lead poisoning and those kind of things that also can be traced to air pollution, poor air quality. So you have an inundation of problems that community folks, or what is also known as fence line communities, people who live in close proximity to these kind of facilities, stationary and mobile sources, living next to freeways, and abandoned factories and other facilities, unchecked corporate behavior when they decide to stockpile mountains and hills of dust, slag, and other things that can blow away and not even be contained. Those are some of the other reasons that pre-exposes the community to these issues. And I will say, in addition to all of this, particularly when it comes to children missing school because of air quality and asthma attacks, their inability to catch up academically and to be challenged academically is very profound. And then we begin to talk about the schools to prison pathway that even occurs, because when children are not able to compete academically, not able to, they struggle socially and they struggle academically, and the end result will be for a good portion of the community a prison sentence somewhere because of their inability to be able to thrive in society. So this might sound like, wow, Donnell, you're all over the place. But that's what environmental justice does, is bring this conversation and put it in a place where we can look at all the connections that are needed to solve the social problems. So I'll stop there. Hopefully that helped to answer that question.
Brianna, do you want to ask this question?
I'm sorry, I was writing notes. Okay, thank you. So the next question is for Dr. Schultz. What are the key demographics, neighborhoods, the age groups, et cetera, that are affected by poor air quality in Detroit? And why is this the case?
Yeah, and I want to appreciate Danelle for already beginning to bring us into this conversation and talking about some of the historical precedents that have created the contemporary landscape in Detroit in terms of both demographic groups and also who gets exposed to what. So we know that Detroit is not unusual in being a redlined city. In the 1940s, redlining occurred in, I think, many, or if not most, urban areas that were, I think the cut point was over 40,000 population. And what redlining meant was that banks and mortgage companies would take a look at communities and they would make some decisions about how desirable properties were in different areas of the city. And ultimately, the decisions that they made, so redline communities were considered to be those that were deteriorating or the least desirable properties. And then there were different color codes up to, I think, yellow meant the most desirable. And those decisions those redlined maps were ultimately used by the banks and the mortgage companies to make decisions about where they would give mortgages or make money available to residents to do home improvements and that sort of thing. Detroit has a history of redlining. It has historically been one of the most segregated communities in the United States. It has begun to become a little bit more integrated, but over the past several decades, it held that it's not an enviable position. And so that is part of Detroit's history. And one of the things that has meant is that in communities, and redline communities were disproportionately, predominantly African-American communities and other communities of colors. So what that meant is that people who lived in communities that were redlined and owned homes in those communities or rented properties in those communities had a lot of difficulty getting mortgages that would help them maintain their homes, keep up their property values, and that sort of thing. If you look at a map of the redlining that occurred in Detroit in the 1940s and map that onto areas of the city that currently have some of the highest rates of pollution, there is a very close correlation between those maps. And so we can see how that historical precedent is linked to contemporary levels of exposures in the city. And the question here is, what are the key demographics? The key demographics are that neighborhoods that have higher proportions of African American and Latino residents are more likely to have higher levels of what's often called cumulative exposure. And this is a term that Nick already introduced. This idea is that in areas where there are lots of pollution sources in close proximity, the residents are exposed to pollutants that come from not just one of those emission sources, but from all of them, right? They all go into the air, they become part of the mix that people in that neighborhood breathe in. And so actually coming out of the environmental justice movement has been a strong critique of the ways that we have legislated and made decisions around air pollution, which are single pollutants and single plants often are given permits. And EJ communities have been in the forefront of saying, wait a minute, what we're breathing in comes from multiple of these sources of pollutants, and we need to have a way of looking at the combined effects, right, of all of those emission sources. So that in many circles now is called cumulative risk or cumulative exposure. So communities with high levels of African American and Latino populations tend to have higher levels of cumulative risk. This is true in Detroit, where more segregated and predominantly African American Latino communities have higher levels of air pollutants. Also, lower income neighborhoods, there's a strong, significant correlation with income as well as demographics of the communities. And another thing that we do begin to see happening is that there is a significant association with communities that have high proportions of young children, children under the age of 5, and high proportions of elder residents. So residents who are over the age of 60 tend to be exposed to higher levels of air pollution. This is of particular concern because the evidence base is pretty clear that for many pollutants, because of where they are developmentally and also things about the amount of air they take in proportion to their body size, children are more adversely affected at any given level of air pollution that they're exposed to than, for example, a healthy adult would be. Similarly, we do know that elders are more likely to be adversely affected at any given level of air pollution. So the fact that we see higher levels of exposure in communities that have large proportions of children, large proportions of elders, means that not only are they getting higher exposure, but they're likely to be more adversely affected by those exposures in terms of their health outcomes than would, for example, a younger adult be. So those are issues of continuing concern in the Detroit metro area and have guided, Nick, I appreciate mentioned the Community Action to Promote Healthy Environments, which is a partnership that actually Nick, Donnell, and I are all part of. It's a community-based participatory research partnership that is focused on taking action to improve air quality and reduce health inequities in the city. And we are particularly focused in on neighborhoods where we see high levels of cumulative risk as defined by high levels of air pollution and high proportions of vulnerable populations, to do work in those areas, because we've demonstrated through some of our modeling that if we can bring air pollution down in those areas with high levels of risk, we will have a disproportionately positive impact on the health of residents. And it's particularly important for us to be focusing our energies there. Thank you, Shreya, for giving us a shout out in the chat.
For our next question, what has the Detroit City Council done, and what have state legislators done to combat the issues that are currently being faced by Detroiters, and what's currently on the floor to alleviate these issues?
Great question. And so first of all, I'll get some of the boring legal stuff out of the way quickly, and I'll try and make it as entertaining as possible. So we've talked about the Clean Air Act already, right? And the types of pollutants that are covered by the Clean Air Act. That's a federal law. So that was passed by the US Congress, signed by the president back in 1970. There have been amendments to that law over time, not many recent amendments. So the Clean Air Act applies across the country, and think of that as a minimum. That's like a baseline that every state has to meet the standards within the Clean Air Act. They passed something called the State Implementation Plan, which we have here in Michigan, that demonstrates how EGLE, as Professor Huang mentioned, how our Environment, Great Lakes, and Energy Department will meet the requirements of the Clean Air Act through the State Implementation Plan. But that Clean Air Act, that is the minimum. So states can have more protective laws. They can pass rules, regulations, laws promoting healthier air, cleaner air. They have the discretion to do that, so long as they don't conflict directly with that federal Clean Air Act, and as long as they are more protective than that minimum standard that Congress set out for every state in the country. So in Michigan, we do have some additional laws that can be used to promote air quality. There's a law called Rule 901, which is basically a blanket. We don't want smoke, soot, other air pollution in our communities in Michigan, and the state can regulate it. That rule is often cited to try and get at things that are not dead on bullseye issues for the Clean Air Act, but it might be like smoke or other types of emissions that maybe aren't directly regulated in another area. And then, of course, as the question sort of prompts, looking at what we can do at a local level is also very important. So like the state, the city of Detroit can also pass ordinances, which are basically laws that govern activities within the municipality of Detroit. They can pass ordinances aimed at promoting healthier air and improving air quality, so long as they don't conflict or aren't contrary to state or federal law. And so you'll see things like, currently in the city of Detroit, there's a move to update and pass a improved anti-idling ordinance. Idling would be a truck. We talk about these diesel trucks that emit a lot of pollutants, including particulate matter, those fine particles in the air that then lodge in our lungs. To stop trucks from being able to just sit and idle in front of a business or while they're waiting to unload or waiting to go across the bridge into Canada or come across into Detroit. Huge issue for air quality in the city. And so, trying to reduce that amount of idling is important. There's other things the city can do in terms of regulations looking at dust. So recently the city passed an ordinance for the bulk storage or the large storage of materials out in the open where the dust can blow off and create all sorts of problems in terms of particulate matter pollution. So Councilmember Raquel Castaneda Lopez has been instrumental in working both on that bulk storage ordinance and then also looking at this anti-idling work and updating that. And there's other things that can be done. Addressing this issue of cumulative impacts or cumulative exposures to pollution, as Amy was talking about, that's something that could be addressed at the state level through permitting. The state could require companies to demonstrate that while they may satisfy a Clean Air Act permit requirement, they also aren't contributing to other issues based on the mixture of chemicals and pollutants in the air that are coming from other sources. That's controversial because it will cost companies money. Flat out, that's the reason why. It will cost money to do that kind of analysis and to have that kind of regulation in place. And so it's a question of the political will to require those types of solutions to be put in place. But they are not barred by the Clean Air Act. There are ways to get at this at the state and local level. It's typically a question of the political will and understanding that, look, jobs are important. When you talk about some of these discussions, whether it's around the Detroit incinerator or the Marathon oil refinery, which we haven't mentioned yet, jobs are important. And then there's a question of, are those jobs actually going to Detroiters? Are they going to people in other areas that aren't, burdened by that pollution, living there in the neighborhood? And so, these are all part of the mix when we talk about the politics of this and the policy development. You have to understand that things that cost money, there's going to be pushback from industry. There's going to be pushback on elected officials, and so they need to hear from us. They need to hear from the community that we're demanding action, because if they're only hearing from industry lobbyists and that's all they're hearing from, we're not going to get these new laws and regulations that we need at the state and local level.
If I could just jump in really quickly on something Nick just raised for us, which is this sort of false dichotomy, right? You can either choose jobs or you can choose to have a clean environment, which is untrue. We can have a clean environment and we can have good jobs. One of the things that often gets buried in those conversations is the exposures of workers in some of the plants and facilities that are the worst pollutant sources themselves. And often people who work in those facilities have incredibly high levels of exposure to toxins and chemicals that, may also go into the air, but when they're handling those on a day-to-day basis or breathing them in the plant that they're working on, those workers have incredibly high health risks that can have incredibly high health risks associated with those exposures. So it is really important to point out the falseness of that dichotomy and to make sure that we're talking about protections for workers as well as people who live in communities with those pollutant sources.
I had never actually thought about that issue, so that's a good point.
Yeah, I agree with Sora. That was a great point because, yeah, all the big businesses will say, well, what about jobs? They need jobs. And so the point you brought up is, no, that you don't have to choose between one or the other. So just a reminder, for sake of time, we have about 10 minutes left. So we have 2 questions left. And I think these will answer a lot of those audience questions in the chat. So make sure you pay attention to these next couple of answers. So for Dr. Huang, what are the solutions to minimize air pollution? And how can we work with urban planners in order to increase vegetation barriers across Detroit? And how can the use of air monitor technology like yours help us do so?
Those are very, very good questions. And in my view, there are many ways that we can reduce air pollution and even minimize the air pollutions. So firstly, the most effective and efficient ways to reduce the air pollution, of course, to reduce the fossil fuel combustions, because fossil fuel combustions contribute a majority of the air pollutants. including our tailpipe emission, industrial level combustions. So, and in addition, fossil fuels combustions dominate greenhouse gases emissions as well as air pollutant emissions globally. So my suggestion is that if possible, everyone should use like the biking or even public transit, and including buses and trains for commuting every day. In the future, if possible, the European countries have done this greatly because of the smaller areas and it convenient for like the biking and this kind of buses, right? And secondly, from the perspective of engineering process, we could design effective air pollution control devices to reduce the air pollutant emissions. Thus, can on the industrial levels can reduce the emissions, and then it can prevent the leaking to the ambient atmosphere, or even eventually emits to the ambient atmosphere for this kind of air pollutants. And lastly, I would like to suggest that over the city or even like urban domains, due to the high population densities, we could maybe propose, if possible, to maybe relocate this kind of highly polluted industrial to some of to the downwind sides, especially those areas that has lower or even no human beings live nearby, right? So that can substantially or minimize the air pollution exposures associated with human health. And the second question here is about the vegetation barriers. It has pros and cons. Increase in the vegetation barriers, of course, it can reduce the aerosols and trace gas pollutants because it can help the depositions of the aerosols. It can also prevent the transport of the air pollutants, especially over the open roads. But the caveat here is that the trees or vegetation that we plant over urban domains, maybe you guys don't know, it can also emit, we call the air pollutants called like the biogenic volatile organic compounds and also pollens. And this is the air quality relevant because it can lead to the productions of ozone and also the secondary organic aerosols, and pollen, of course, can cause asthma, right? But for this kind of ozone and secondary organic productions is really important because that's air quality and human health relevant. So that is why air quality scientists need to collaborate with urban planners and also other scientists to co-design the configurations of the vegetation barrier, including the selections of plants or trees for the planting over the urban domains. And in terms of the air quality technologies, that's a very good question. Like I said before, I think purple air is a really good tool because that's low cost and it can enhance the network, monitoring network. For example, over Metro Detroit, we can, of course, increase the number of purple air sensors to measure the PM 2.5 mass concentrations. Of course, ozone and sulfur dioxide is big problems over Metro Detroit. And that is very challenging, to be honest. To reduce the ozone concentrations is much, much harder compared with the PM 2.5 because we need to consider the emissions, we need to consider the chemistry, we need to consider the meteorological conditions as well as the transport. So that is very complex to reduce the ozone. So in summaries, we need to do more efforts to improve our understandings of the air pollutions over our Metro Detroit, especially for the ozone. Thank you.
Okay, and our next question is aimed for Ms. Wilkins. What relevant community groups are working on the issue of air pollution in Detroit, and what progress have they made? Are there specific ways that Scipol-Detroit members can get involved?
So thank you. Real quick, I'd like to just kind of add a little something for consideration based on Dr. Huang's answer. I would throw out that some of the technology approaches, though that they are good and they give us, possibly real time information and patterns and trends, it doesn't provoke necessarily those who can make decisions to make decisions based on that information. And while we may collect a whole lot of data and do a whole lot of research and write great papers and all that kind of stuff, unless we're able to do something with that information, it does not serve the community very well, I would say. And I would also add that another approach to how to change the landscape on this is to incorporate a precautionary principle approach to some things. And precautionary principle, a lot of European countries are using this approach because they assume something is bad before they put in place the particular product or process or policy, until they have the information that assures them that it's not going to have a negative impact on the community. And it would be great if in the US that a precautionary principle would be an approach that one would take to consider policy decisions. Now, the other way to get the change is community, right? It's grassroots folks, fist line folks taking a stand, speaking for themselves, and holding folks who are in positions of power accountable for the decisions that they make, right? And so there are a number of grass top organizations that are working in, in the area, sometimes collaboratively, like the Cafe Project is one of those that bring multiple organizations to the table to think about specific ways to help change the dynamics around air quality. But there are groups like the Michigan Environmental Justice Coalition that serves the entire state of Michigan that has a particular group called the Clean Air Council, where they are bringing grassroots folks together, teaching them and training them on the particular issues around air quality in our area, and then arming them with the kind of information about policy influencing and educating policy makers, and themselves on how to move the needle on improving air quality in our community. So that's one. There is the Detroit Environmental Agenda that is being coordinated by Detroiters working for environmental justice, who are putting together sort of approaches to question those that are interested in running for office, to create an environmental agenda that they will respond to help decide who's worthy of our vote. There is the Detroit Asthma Coalition, which I'm very active in. We've created an air quality management plan, an approach trying to find ways to address the asthma problem in Detroit and bringing into the conversations the issue of outdoor air, where primarily the focus has been on indoor air over the years, and how do we make certain that environmental exposures are considered in seeking ways to mitigate the issues of asthma. I'm sure I'm going to miss some folks. There are right now, that's all. Oh, and the other one would be the Climate Action Campaign, which is a Midwest initiative that Michigan and Wisconsin are connected and I'm involved with, where we're trying to bring in also the impacts of climate change and its influence on air quality and the public health impacts that brings. So there are a number of efforts. They're pushing and supporting certain policies at the state and the federal level. And I would finally say that, you know, in terms of the Scipol-Detroit group, there's so many places for you to plug in. We need your voice, we need your energy, we need your volunteerism and commitment, and we need your expertise or whatever it is that you're focused on that'll help inform policy, that'll help inform a process and move us towards action and lend yourselves to helping action be achieved. I will say there is this dynamic. I don't know where everyone is from in Michigan, if there are places where folks at the state legislature that you live in or your family lives in that can influence folks who really have a negative opinion of Detroit, and anything that can benefit Detroiters, they're going to vote against. We have a real hill to climb when it comes to public policy in the state of Michigan. So supporting, I see that there are some recommendations for action around some things that Senator Chang and others have put forth, supporting that and making certain that folks who don't necessarily support an agenda like that at the state legislature get behind it, and you have influence. So it may not necessarily be about moving a needle in Detroit as much as moving a needle in other places in districts where you may come from that can move this. And if you're like, well, I'm just going to school here in Detroit, but I'm really out of New York or DC or whatever, then there's an ability to influence public policy at the federal level as well. So as this new administration focuses on building back better, investing 40% in hard-hit communities like Detroit, aligning investments for climate and renewable energy and all those kind of things. Let's make sure that it really gets to places like Detroit that makes a difference. So you have an ability to influence at all kinds of levels, and I would encourage your engagement and participation in that. I'm sure there's some other things that I could mention and when I'm not having a senior moment, but at this moment, those are the best that I could come up with. And believe you me, no one will turn you away if you reach out and say, hey, I would like to work with you, Green Door, Cafe, whomever. Thank you.
I just wanted to add really quickly for anybody who wants to get involved and take action towards this, our action groups this summer, we have an air pollution action group. So for anybody that wants to get involved, there's been 100 links that have been sent out over the last couple of months about this. We are like in the last week of sign up. So sign up, get involved, and do your part in taking action.
Yeah, and I just want to quickly thank our panelists for being here today. That was amazing, I have to say. Your expertise and your knowledge is so helpful for us when it comes to learning about this issue and knowing what is right and what is wrong, especially with the media and with companies trying to tell us how we should think and feel about this issue. So I just want to say thank you so much. And in the future, we would love to work with you all again. And like I said, Dr. Huang will be heading our air pollution action group. And like Brianna said, we are planning to actually take action on this issue. We're not just going to stop with this panel. We want to continue our work and develop a coalition where we can go to lawmakers, approach them and say, here's the policy that we're interested in, here's what you should implement, because based on the research that we are doing, we know that this will work.
It's a lot more survivable than
oh, someone's mic is on.
Yeah.
Benjamin, your mic is on. Okay, great. And he was interrupting my little spiel there. But anyway, if you are interested in meeting with state lawmakers about these issues in particular, we have air pollution, water injustices, community violence, as well as lead exposures. We will be meeting with lawmakers for each of those issues. And if you're excited and want to get involved with a certain issue, please make sure to sign up. We'll send another email about it, and I also put one in the chat. So thank you to all of our attendees for joining us today. And again, to our panelists. Sorry we didn't get to the audience Q&A, but I definitely think that our panelists did a fabulous job of answering all of your questions anyway. And like Donnell said, it's all about us taking action and us putting in the effort to combat this issue. So
before everybody goes, I got something that I just wanted to add. So this will be posted on YouTube. So because everyone really liked this panel, I would highly, I just request that everybody share it around and we can get the word around about the issue that we were discussing today.
Yeah. And just a reminder, our next 2 events will be reserved for those who completed our best training workshop with the WSU Government and Community Affairs Office. And our next event is actually next week. I know we do events every 2 weeks, but this one will actually start next Thursday at 1. And if you are invited to this event and a spot is reserved for you, you will receive an email shortly after we conclude this event regarding next week. So again, action groups, thank you for being here, and I hope everyone has a wonderful, wonderful weekend.